Welcome to the show, everyone. You know, I always say that I like to talk about everybody else except me, and that's what we're doing here on the show. And I want to say hi to everybody on Facebook, so hi to everybody out there. And I also want to say that it's still senior season in the air right now.
Yes, it is.
So first of all, I want you to get real close to that mic. And I want to introduce my guest. I have with me Jennifer Walker, who her mother is actually not here today, unfortunately. We have Helen is out right now, but Jennifer Walker is the owner of Walker and Walker Health Advisors. And I welcome you back to the show. You've been here several times.
Thank you.
I want you to sort of talk a little bit about yourself.
Yes.
Okay, what you do, and you have a special guest with you today, and I'd like you to introduce him.
Of course. So Walker and Walker Healthcare Advisors, we definitely assist seniors in finding those Medicare plans that best suit their needs. So we're focusing today on specifically going into that doctor's office and seeing how quickly you can get in, how well the doctor's treating you, and getting the assistance you need. While my mother's out, I have brought with me Daryl Young. He is at one of our value-based clinics called Centerwell, and they do a great job of their specifically senior primary care doctor's offices.
What is value-based care?
Thank you for asking, Carol. It is basically healthcare focused on seniors. We only treat Medicare eligibles. They could be eligible for Medicare through a disability, but most of our clients are 65 and older, Medicare eligible, and that's how they access care. In value-based care, we are in a risk agreement with the insurance companies to provide that care, meaning that once we take on that risk, we're paying all the claims. So we're innately connected to ensuring that we're keeping them healthy and hopefully out of the hospital and on a trajectory of health and improved well-being and all of those things. So value-based care really is the commitment to our seniors to take great care of them, try to keep them happy, healthy, and out of the hospital.
Thank you. Finally, somebody has been thinking about us seniors, because you mentioned before you came on, like the last time we were going to talk about this, and there's a way that they've made it so that it is, I should say that it's senior friendly.
Yes. So there's several things that come into play here. There's things as simple as non-slip floors. So trying to walk in and get there. They have wider walls. So if you're wheelchair bound, things like that, you can easily get into those exam rooms. They have people that are height challenged like myself. They have the chairs that actually move up and down, so you're not trying to jump onto the exam table or get back down.
Oh, I love that.
Yeah, very much so. And then a big thing is right now we have folks that are trying to get in with their doctor. They're sick, they're not feeling well, they want to get in. And they call and they are told, well, we can see you in 2 weeks, 3 weeks, and sometimes that's, if you're lucky, that's what they give you.
Mm-hmm.
But at these places, they actually allow you to get in same day, next day, 48 hours at the absolute latest to get in. And so it's really nice that they take into consideration that you need to get in to see the doctor at that time.
And we do. I don't care who you are, when you call the doctor, you want to be seen right away. So, how do they find out the information on all of this? I mean, where do they learn about it? Like you're saying, you're not the only ones that obviously have this program. Is that correct?
That's correct. There are other places that are out there. If you come to our website, we can assist you in finding out specifically based on your doctors what places you can go that accept your carrier's insurance, that you can see those particular doctors.
Well, their website is Walker Health Advisors is with an E. So Walker Health Advisors with an S.com, and you can get all the information there by going there. And I suggest anyone who is a senior should really go up there and check it out. Where age it starts at Medicare eligible
Medicare
age?
eligible 65 that are out there, and it's really good because you're finding out places. You're not worried about little people running around in that waiting area while you're waiting to see.
That's another thing that we kind of don't like.
Yeah.
Well, let's talk about some of those other things and what, how this came about. How did you decide? I mean, obviously you might have gotten a little complaints or something. What happened that you got into being able to do this for the seniors finally.
And it's really nice, and I'm gonna let Daryl kind of hop in on this one, but it was one of those things that I believe a few years ago, because in Arizona, we have large population of Medicare eligible folks. So we started off almost as a pilot program to see how it would work. The reason I wanted Daryl to come talk with us is because Centerwell specifically, as they came in a few years ago, they've been very consistent about the care that they're providing to the senior population that's out there.
But it sounds more than that. Go ahead.
Yes, I think that's at the core of what we do is senior care and really catering to them. Jennifer spoke to the clinics being built specifically for seniors, but these clinics are geared towards geriatrics. They're geared towards their unique needs, their unique care that they require. So we really focus on all of the social determinants of health. That's a really common term in the world right now. So it's a holistic care. It's not just treating the illness of today, but it's really managing their health long term and helping them again live a more active, healthy lifestyle. That's at the core of what we do every single day.
You know, I think that we as seniors, you call them geriatric population, I think that we are all living longer, right? Which is great that you are. But we still get sick, right? Other things happen where you're not necessarily gonna pass away, but you need to be seen. It might be that you have a chronic something that is not maybe gonna take over you, but you have something that bothers you. What kind of health care do you care for? For instance, let's say, you know, can they come to you for pain management? I wanna go deeper on it.
Yes, ma'am. Yes, ma'am. All diagnoses. Again, once the patient is, I guess the word is assigned or attributed to us, they are under our care. So when they need access, to the point about access, get in the same day, that's generally for acute stuff. You know, I'm sick, I cut my finger, you know, I have back pain. Those are the acute things. But the long-term things, the diabetes, the heart disease, the things that are chronic, to your point, Carol, is what we manage and try to help them manage better. A lot of that is focused on medication adherence, making sure they're taking their medications, they didn't forget a day, because you can forget a couple of days and end up in the hospital, and now that's a really costly visit. So that's what we do, is managing health from today's illness to long-term health.
Question, just to make it clear, because everybody has their doctors, okay, is this something that goes along with that?
Yes, so the primary care, we hope to be the quarterback of their care.
That's what I meant.
Yes, ma'am.
That's why we do this show, you see.
Yes, ma'am. So we send everybody out to specialists. You know, they have their cardiologists, they have their endocrinologists, their pulmonologists, whatever their ailment is, they're going to be able to leverage and see those specialists. We just want all that data back to us so we can help manage it better, because a lot of times the cardiologist isn't speaking to the urologist, isn't speaking to the other specialists. So that's what we do as the quarterback of their care.
Now, you can go onto Walker Health Care Advisors with an E, and you can also call them because they do free consultations. Your service is a free service.
Correct.
Because you work with Medicare, which is right now, right? And it's your season. But we're just kind of talking about this today because it's something that is out there for you, and they want you to know, and they're doing it here on the show, and I appreciate that. And where else but on Networking Arizona would they do this? So their phone number to call is 602-750-0620, and you could check out all this information that they're talking about today, which is on Walker Healthcare Advisors with an E.com. Before we go, just 'cause we're going to go to a break right now, what are your final words for them for the moment?
Right now, for the moment, think about what's best for you. Sometimes you're afraid to change your doctor, even though you know they're not giving you the care that you need. Make sure you're putting yourself first and then you're getting the care that you need. That's the biggest thing.
And what it sounds like to me is you're still gonna have your doctor, you're just gonna have somebody that's there with you, shadowing kind of or quarterbacking with you, right there along with you. If you have something that you don't feel good and you got a bad cold and you feel like it might get into be pneumonia because you're not taking care of yourself, you can go there and you can get in within 48 hours or sooner. You can go up and check them out on the website, which is Walker Health Care Advisors with an E.com. Hang tight, we'll be back in just a minute. Okay,
Well, good.
okay.
I definitely even want to talk about too the visit timing, because that first
The what?
visit,
Visit,
Yes.
first visit.
their
Okay.
initial visits and how long they last, and then subsequent visits too.
Okay,
So that's always a good topic, letting them know you're not gonna get pushed in and out.
okay, we wanna talk about that, perfect, no
Yes.
problems, we'll do that when you get back. And we're still on live on Facebook, so, when, that is so important, that the time that you take with them, right? And so that we wanna know about that. And how does somebody, qualify for this?
Yeah, basically being Medicare eligible, right?
Just Medicare,
So-
that's it.
So Jennifer.
anybody?
Yes, so
Okay.
Jennifer and Helen, they handle the insurance side of things, they're the experts in insurance,
Mhm.
and then we're the experts in care, right?
Okay.
So, it's a perfect relationship, it's a symbiotic relationship, it's one that, kind of yin and yang, if you will, and we need each other,
Mhm.
because they're the ones that are educating them about the coverage they need, and then we're the ones that are telling them about the health care they need. So
Mhm.
it really works really well together, and
Okay.
we work in close partnership with our brokers that just, we rely on for growth. We
Mhm.
really do rely on them for growth, and again, it's all in the best interest of the senior.
Okay, that sounds really good.
So no, that'll be big, talking about their visits. They actually can come in and take a tour. So
Yes, we do.
they take a tour, that way they're not tied in anything, but they can see how the office runs. And if they're lucky and they time it just right, sometimes they can even meet the doctors. Because you're gonna meet staff, you're gonna see how things are run, you're gonna get to tour the facility. But timing wise, if the doctor's available and in between appointments, you can actually shake the doctor's hand
Wow.
and see who you're gonna be.
Yeah, that's,
Dealing
I think everybody would like this.
Yes, ma'am. I think so too. Yeah, we're blessed.
So we've got those, and then we can let them know too, something as simple as they can get their blood drawn in the doctor's office, they don't have to go out.
On-site labs,
Yeah.
yes, on-site labs. We try to do as much in-house as possible. If needed, if we discover a need, we can offer transportation, so we can get them an Uber to the clinic. So that's always nice.
We'll try to get to it all.
Yeah, it's all good.
There's plenty, that's like,
There's a lot.
that was like,
Yeah.
there's so much, there's
a
the,
lot.
Yeah.
if my kids are in another state, we can get them on the TV screen
That's
and they
right.
can be
We
a part of
do
the
telehealth.
appointment.
So
Yeah, we can do that.
telehealth.
Telehealth, yes,
Well,
absolutely.
We'll try.
Yeah.
That's why I was like, he can come, there's plenty to talk about when it comes to these.
Yeah.
Talk about,
That,
yes.
oh, wow.
So no, it's good. He did give us a heads up on these back on.
Yeah, we put two of them on for you today.
Ah,
It's commercial again.
yeah, I heard the first one earlier.
Mm-hmm. Welcome back. Now, we are talking about something that most people probably don't even know about, okay? And that if you are Medicare eligible,
Yes.
you are eligible to have this, it's called value-based care, that is gonna be like a piggyback on what you already have, right?
So it's gonna be a primary cares office, really, that we're talking about with that value-based care. So they're the ones, that's why Daryl said quarterback. So they're gonna be your primary
better
care
than
office
Piggyback.
that was gonna make sure that they're helping to facilitate all the care you need. So if you've got other specialists out there, cardiologists, endocrinologists, they're gonna be working directly with them to know all the different kind of care that you're needing and that you're actually getting.
So if you're 65 and you've got your Medicare, this is something that you can look into. So, and there's a lot of you guys out there. So go up on their website because all the information is there. It's Walker Health Care Advisors with an E.com. Okay, there's so much that you offer. Number one, you wanted to talk about their visits, what they're like. Listen to this, ladies and gentlemen.
Yes, ma'am. So this is really the difference, right? A lot of times you go to the doctor's office and you get 30 seconds a minute, maybe 2 minutes with the doctor. Here, our doctors spend on average of 30 plus minutes. They're booked for 40-minute available slots.
Get up to that mic so
Yes,
they can
ma'am.
hear that.
Yes, ma'am. 40 minutes available slots. We do have 20-minute acute visits if it's something fast. You just have the sniffles and you need some medicine. We can see you quickly. But the bulk of our visits are 40-minute visits, and the doctor really has a lot of time to not only address all your concerns and your needs and your chronic conditions, but also get to know you at a deeper level. It's really about relationships. It's
Isn't that
about
nice?
Yes, it's about relationships, understanding exactly what you need, so we get you the specific specialist you need to take care of you the best.
Okay, and you said subsequent visits are like what?
20 minutes if it's just a quick follow-up. But we have subsequent visits. It may be an annual wellness visit where it's another 40-minute visit, or a comprehensive visit where it's 40-minute visit. So your new patient visit's 40 minutes, but many of our other appointments are 40 minutes as well. And that's time with the MAs. The entire care team will be there. I think that's another important part of value-based care is we have a lot of other services, social work, behavioral health, care coordinators, care coaches, all of the things to help you, again, stay healthy and manage your care better.
But they do so much. If you can't get to the doctor, you can get them transportation.
Correct, yes ma'am. If we discover the need that they're having a hard time getting to the clinic, we can offer them transportation. We use Uber Health, so it's really easy. We go in the app, we order it, it's there, and you come to the clinic and we treat you, and you get great care. So we definitely leverage transportation resources when we need them.
Now, also, you say that you have, you can take the blood right there on site.
Yes, ma'am. We have an on-site laboratory. Saves you just that extra trip, right? It saves you that extra trip to an external lab. We do it right there on site. We drop the orders, and generally you get the results back within 24 hours. You can see them on your patient portal, and then of course our doctors are expected to call you back, especially if there's anything abnormal. But peace of mind is important.
They also do this. There's non-slip floors, so nobody's gonna fall. They also have wheelchair access for everybody. Chairs and the exam tables go up and down, so you don't have to try and get up there yourself. Also, you get called back within 48 hours, and you can actually get your in to see maybe even right away.
Yes, ma'am. Part of our, again, if somebody's sick, we want them coming to us first. We want them to call us first. We would hate for them to end up in the urgent care or the emergency room when they could have came and seen us. So that's a core component of our care.
Now, also, you do tours.
Yes, ma'am. We do a lot of tours to come see the facility. Hopefully you come at a good time and you can meet the physician and know who you will be seeing. A lot of times that's really the key, right? Is when am I going to see the MD, the doctor, and not just a nurse practitioner or a physician assistant? Obviously we leverage those resources, but we really want them to have a strong relation with their PCP, their MD or DO.
And you can check that information out that you're hearing here right on their website, which is Walker Healthcare Advisors with an E.com. So some people might be saying, well, why didn't my guy tell me that, about that? Can you talk about how this happened?
Yes. So you really want to make sure that you know that it's out there and available. And sometimes if they realize or they think that you're stuck with that primary care that you're seeing and they don't know the bad experience that you're having, they're not going to say anything. This is one of those things we like to advise you so you know that it's there, because we recognize that this is something that happens to a lot of people. You go into your doctor's office and how dare you have two things that you want to talk about, and they tell you, no, we can only talk about one. You schedule another appointment to come back again. Or worse, you get there and you're sitting in the waiting room for longer than you're actually seeing the doctor. So as we hear these things,
I hate that.
As we hear these things as agents, it's our duty to let you know there's better options for you out there. Just because you've been seeing this particular doctor doesn't mean you have to stay that way. Mm-hmm. You have the option, you have the right to have better care. And in these scenarios, it really truly is overall care, right? Because you're hearing about the social workers and things. It's not just one stop there. They're making sure that you as an entire human being, you're whole.
So you say that every everybody who's 65 or older that's getting Medicare is eligible for this, right?
Correct.
How do they know to be able to get it into their plan? Does it pay, all of that?
Right.
Gotta ask it.
You gotta know. And so the big thing is making sure that the plan that you're on accepts the places that you go, and
Okay.
that's where we come in.
And how many places do you have throughout the valley?
Yes, ma'am. We currently have a dozen clinics across the valley. Currently working on a few more that we'll announce soon, but 12 locations currently
That's
spread out
not
across
bad
the
as far
valley.
as I'm concerned, spread out
Yeah.
where?
Spread out. So Sun City, Surprise, Glendale, Mesa, 2 or 3 clinics in Mesa. We're in North Phoenix. We're in Maryvale.
And is
yes,
that
ma'am.
information also on your website, or they can call you?
They can call us and we can give them that
It's a
information
free
for sure.
service for you to get this information. I think everybody that's listening should be calling and getting this information so that they understand and whether it works. And by the way, this is something I have to say, and I think I'm stepping on your toes here for a second, but that even you're listening to this and you've already changed your plan, you already think you're all done, you can still change up until
December 7th, midnight to December 7th, whatever the last thing that got submitted, that application, is what goes into effect on January 1st.
So
you-
I
you've got
think,
time.
everybody, please listen up. Call them, have that consultation with them and find out what this is all about. Find out if you can get this,
Yes.
because I think it sounds lovely for almost everybody to want it. So their phone number is 602-750-0620. Go up onto the website. It's Walker Healthcare Advisors with an E.com. Okay, let's talk more about it. I mean, it sounds fabulous.
It is, and what we'll do for you is, based on where you live, we'll look to see what location is closest to you. So we'll
That's
do the
nice.
heavy lifting for you, and we can even go as far as helping to schedule that tour if you really want to go see it. I like to refer to it as try before you buy.
I like
So
that.
go there, check it out. They're not gonna hard sell you or anything like that. They're really gonna show you what they have to offer, and they believe in the product, right? And they're gonna make sure that you see everything that's available to you, and that way you can go ahead and make that decision on your own. Is this something that works for me? And 9 times out of 10, the answer is gonna be yes, because it's why would you not?
So, exactly. It's called value-based care,
Yes.
okay? And your facility, your primary care facility, yours here, Daryl, is called Cinerwell.
Yes, ma'am.
Spell it.
Yes, ma'am. Centerwell, Centerwell, Centerwell Senior Primary Care.
Okay, and so you can check this out on their website, and they have all the information there. What are your final words for everybody out there?
Final words is, I love working with the Walkers because they're doing what's right for our older adults, and that's what we're trying to do on the same side for care.
Geriatric population. And this is something that I think everyone who is eligible for Medicare should really look into. So their phone number again is 602-750-0620. It's Walker Healthcare Advisors with an E.com.